informal than our regular business meeting, but you'll still have an opportunity to comment. Most importantly, we have 6 items on our regular agenda tonight. The first one was an executive session, which we have already concluded. So we're now on item number 2. After each one of these items, you'll have an opportunity for public comment, and you might want to write down this number. This is the number you should call to offer your public comment. The clerk will answer the phone and put you on, and we'll all be able to hear you. The phone number is 237-6196. Don't call that yet. But after each one of these items, I will announce an opportunity for public comment for anybody who calls 237-6196. So welcome, everyone. I will move on to item number 2, our COVID-19 update. But first, I'll ask our city administrator, Chris, is there anything in the way of preliminaries that you'd like to offer before we ask our county health officer, John Felton, to tell us about our COVID-19 situation? Chris. Okay, thank you very much. John Felton, I see you out there in cyberspace. What can you tell us?
All right. Good evening, everyone. Thanks for having me back. We do have a lot of things going on, obviously, in COVID land. I'll go through the data here in a minute. A couple other things I want to mention. Today was our first centralized vaccination clinic. We had about 450 appointments this afternoon out at Cedar Hall at Metro Park. It was, there's an old saying that no battle plan ever survives the first encounter with the enemy. So we had lots of plans, and as they were kind of being modified on the fly, we got a little behind schedule. The power went out, so there's a few things that happened out there. But overall, I think this is going to work really well. So that clinic is being staffed by a combination of people from Riverstone Health, Billings Clinic, and St. Vincent Healthcare. As you know, up until this week, we've had 3 sites for vaccination. St. Vincent Healthcare, Billings Clinic, and Riverstone Health were all doing relatively smaller clinics. And I think it is important to remind ourselves that the vaccine that comes to our community, regardless of whether it goes to Riverstone Health or one of the hospitals, is really community vaccines. So we've always been doing community clinics. You've never had to be a patient of Riverstone Health to get vaccinated here, or one of the hospitals to get vaccinated there. We did take so we've gone from 3 sites with 3 websites and 3 phone numbers to schedule to right now 2 sites. The Metra, where we combine the doses that were sent directly to Billings Clinic or to St. Vincent Healthcare and Riverstone Health. Billings Clinic is going to have 2 more weeks on its site. And after that, we'll only do the centralized sites where we'll all be staffing them and combining all the doses together. There are other doses coming out. I learned today that 2 pharmacies are going to receive doses in Yellowstone County. As more doses become available, as we talked before, we anticipate that medical practices, pharmacies, and a lot of other places will get doses. But as the Unified Health Command, we will continue to offer the centralized sites. For those people who got their first vaccine at either Riverstone Health, Billings Clinic, or St. Vincent Healthcare, they'll also receive their second vaccine at that same site. For those who are getting their first doses at the centralized clinic, they'll also go to a centralized clinic for their second dose. So we hope to continue to see the number of doses increase. But after March 1st, then the 3 Unified Health Command medical partners, the 4th partner being Yellowstone County Disaster and Emergency Services, but the 3 healthcare partners will compile the doses that they receive and will work together to put those out. As you know, on January 15th, Governor Gianforte lifted all the restrictions for things like hours of operation, occupancy, group size, gathering size. On February 12th, he lifted the last remaining restriction, which is the statewide masking requirement. Schools can still choose to require masking. Different organizations can, but there is not a statewide mandate at this point. So Riverstone Health, for instance, will continue. to require masking on our campus, and some schools are as well. I'm going to pull up the data here, if all goes well. So, Mayor, I can see you on there. Do you see the chart, Mayor?
We can, and we've got your little slides off to the left and the big one to the right.
Okay, now we're going to try and get just to the slideshow. Got to get rid of this.
Looks good.
Okay, so a lot of these you've seen before, and there'll be updates. I do have a couple new ones in here. So this is the state of Montana. Again, you see our peak back in mid to late November, and then we worked our way down. We saw a little bit of a bump